Thank you for that kind introduction. So I'll be giving a few slides here on the epidemiology of HIV and hepatitis in Europe and Central Asia. So I am employed at ECDC and I have no conflicts of interest to declare. So this is going to be the outline of my presentation. I'll try and provide some background to hepatitis and HIV in the context of the Sustainable Development Goals. Then I'll move on to show you how countries in Europe and Central Asia are progressing towards achieving targets when it comes to hepatitis B and C, as well as HIV, and I'll make some final conclusions. So the Sustainable Development Goals, you're all very familiar with these goals. Goal 3 is related to health, and goal 3.3 is where we have specific targets and goals related to HIV as well as to hepatitis. So let's start with hepatitis B and C. So WHO has been the leading force behind developing a global health sector strategy on viral hepatitis, which goes up until 2021. And WHO European Office in Copenhagen have developed a specific action plan for the health sector response for viral hepatitis. And both of these strategies have specific goals for the European region. So there are 2 impact targets that would need to be achieved by 2030, and those are related to incidence and mortality. And according to WHO modeling, we need to see a 90% reduction in new infections by 2030 in order to be eliminating hepatitis by 2030. And when it comes to death, we need to see a 65% reduction by 2030. And as you see, we have interim targets of 30% reduction in incidence and 10% reduction in deaths by 2020. In addition to these impact targets, they developed so-called service coverage targets that would need to be eliminated by 2030. And these are some of the targets that have been developed by WHO. You see the best baseline here on the first column, 2015. You see the targets for 2020, and on the far right-hand side, the targets for 2030. When this global health sector strategy was developed, it was estimated that the European region is doing relatively well when it comes to hepatitis B vaccination for infants, as well as prevention of mother-to-child transmission and blood safety. These are the percentages in green circles. But we're pretty far away when it comes to injecting safety, harm reduction, testing, and treatment for both hepatitis B and C. And these are the percentages in the red circles, where we're pretty far away from achieving these targets. So ECDC does not have very good, strong data and modeling estimates around viral hepatitis, and we have several big projects ongoing. In the meantime, we have to rely on published literature, and this shows you here that the estimated number of people living with hepatitis B virus in the EU EEA is 4.7 million, and for hepatitis C, that number is 3.9 million. The estimated percentage undiagnosed for hepatitis B virus is anywhere between 40 and 85% in EU countries. And for hepatitis C, that number is between 20 and 91%. So there's a huge range here of uncertainty. But what's definitely clear is that a significant proportion of people are living with undiagnosed virus. So testing is a key priority in our region. So I'm going to zoom in on the continuum of care for hepatitis C. We have this for hepatitis B as well, but I'm going to focus now on hepatitis C. Here you see one of the key issues in our region is the availability of data. So this shows you the number of countries reporting data for each stage of the continuum of care for hep C. So only 21 countries have estimated numbers of infected, 16 countries have numbers on the diagnosed, and 12 respectively for people on treatment and those who are sustaining viral suppression. So the availability of data is not very good for hepatitis C. So how are we doing? So this slide shows you the proportion of people living with hep C who have been diagnosed in the EU in 2017. So 16 countries have data available for this area. 7 countries, as you see here, have reached the target of 50%, which is the target for our region. And the remaining countries with data are quite far away from this 50% target. But again, as I said before, approximately half the countries in our region have no data whatsoever on the number of people diagnosed. Moving on to the second target, so the portion of those who have been diagnosed with hep C should be on treatment and here we have 12 countries with available data. Only one country, Iceland, has reached the target of 75%. The remaining 11 countries are very far away from this 75% target. And as you see here, approximately 18 countries have no data whatsoever in this area. And on the last target, you see here the proportion of patients on treatment for hepatitis C who should have been cured. Again, only 12 countries have data for 2017, but the positive thing here is that out of those 12 countries, all of them have reached the 90% target. So this is not surprising. We know treatment for Hep C is very effective. So once you are put on treatment, you are going to be cured. But again, you see the number of countries, 18 countries without any data available, which is of huge concern. So that's all on the hepatitis B and C. I'm going to move on now to HIV. And here, UNAIDS is the body that have developed the definition for what it means to end AIDS by 2030. They've developed these targets showing here. So we need to see 0 new infections, 0 deaths, and 0 discrimination by 2030. And to achieve this, they've developed so-called fast-track targets, where they want to see a reduction in new HIV infections to fewer than 500,000 by 2020, reduce deaths to fewer than 500,000 by 2020, and eliminate stigma and discrimination by 2020. So what does this mean in terms of specific targets for Europe and Central Asia? So we have an incidence reduction target of 75%, which is quite clear. We have PrEP targets globally, but we don't really know what that means for Europe. There's no specific target for Europe. We have the so-called 90-90-90 treatment target, which I'll speak about shortly. Those are crystal clear. But then when it comes to mortality and stigma, the targets for our region are quite unclear, as well as the measurements. So we don't have very poor data around these issues. So we do joint HIV surveillance together with WHO Europe, and this is the latest data we have from 2018, showing you that approximately 142,000 people were diagnosed with HIV in our region. 16% of these cases were diagnosed in the western parts of the region, 5% in the center, and a full 79% in the eastern parts of the region. You see the rates per 100,000 population at the bottom of these bubbles, and you see the huge difference in Eastern Europe, where the huge burden of HIV is in terms of burden in our country, in our region. In terms of HIV modes of transmission, those differ quite substantially within our region. They're quite similar when it comes to the West and Center, where you see that approximately 50% of diagnosed cases occur among men who have sex with men, followed by heterosexual contacts, and only 4% among injecting drug users. In the eastern parts of the region, the majority of transmission occurs among heterosexual contact, both men and women, followed by injecting drug use, and only 5% among men who have sex with men. Another big difference in our region is this issue of migration, whereas in the western parts of the region, migrants account to almost 50% of all diagnosed cases in 2018. That falls to 10% in the center and only 1% in the eastern parts of the region. So moving on to the 90-90-90 treatment targets. So these targets are based on UNAIDS modeling, where it suggested that 90% of all people living with HIV should be diagnosed by 2020. Out of those, 90% should be on treatment, and out of those on treatment, 90% should be reaching viral suppression. If we reach these 3 targets, at least 73% of all people living with HIV should be virally suppressed. And according to UNAIDS modeling, that would put us on track to reach 0 infections by 2030. So let's see how we're doing in this region, and starting with the first 90. So here you see that we have 43 countries that are able to have estimates on this. And if you remember what I said on hepatitis C, very few countries had that for hepatitis C, but many more countries have this estimates for HIV. So 43 countries have data. The overall percentage in our region is 80% who know their status. The target is 90%. You see the countries on the left-hand side in green bars. Those are the countries that have reached the targets. The countries in blue here are the ones above the regional average and which we think are on track to reach these targets. And on the right-hand side in orange, you see the countries that are below their average, and especially those to the far right are going to have huge problems achieving these targets. Okay, let's now go on to the second target. So once you are diagnosed, you need to be put on treatment. Here we have even more countries, 45 countries with estimates. You see that the overall percentage is much lower here, 80 for the first target. Here we're at 65% of people that are diagnosed who are put on treatment. More countries have reached this target in green here, but as you see in the far right-hand side, Russia is below 40% of people that have been diagnosed on treatment, and that pulls down the whole regional average. So countries in orange are very far away from reaching this target. So once you are on treatment, are you reaching viral suppression? So here we have 38 countries with estimates. The overall percentage here is 86%, so pretty much on track to reach this target as a whole, our region. That's not surprising. We know that treatment is very effective. So once you are on treatment, you will be reaching viral suppression in a certain amount of time. So let's see then how many countries are on track to meet this 73% overall target. So 36 countries have data across the continuum. See, these are the 36 countries we're able to do these estimates on. And as you see here, the overall percentage is currently at 44%. So we're quite far away from reaching these targets in our region. Approximately half the countries on this list, up until I would say Croatia, are pretty much on track, but from Slovakia onwards are not going to be reaching these targets by 2020. So to conclude, are we on track to end AIDS by 2030? So looking at the incidence target that I talked about before, this shows you, in the red line shows you all WHO European regional estimates of new infections, and the green lines I've singled out the EU countries because they differ quite dramatically. So the fast track target suggests that we should see a 75% reduction in new infections by 2020 using 2010 as the baseline. So looking at 2010, the red line, we have 119,000 cases and we need to see a 75% reduction. The latest estimates we have show actually an increase of 28% in the wider WHO European region. And if we're looking at the EU countries only, we're seeing a slight decline, but we're far away from the 75% target. And this is where we need to be this year, 2020. So you see, it's going to be virtually impossible for us to be reaching these targets, not only in the region as well, but even in the EU, it's going to be very difficult or virtually impossible to reach these targets. In terms of the 90-90-90 targets, as I showed you, 80% of all people in our region have been diagnosed. 50% of all people living with HIV are on treatment, and 43% of all people living with HIV have reached viral suppression. And you see the targets in the red lines above. But there are big sub-regional differences in our region. In the western parts of the region, I would say that we are on track. We've already met the 73% viral suppression target in our region, in the western parts of the region. But when we look at the center and east, this is where the big problems occur, and especially when it comes to treatment. So we're doing okay on the diagnosis, on the testing. I would say we're still far away in the eastern parts of the region, but we're doing relatively okay. Where the big drop-off happens is putting people on treatment once they are diagnosed. That's the biggest problem we have in our region currently. So to conclude, for hepatitis B and C, I think it's fair to say that we have a lack of solid epidemiological and modeling estimates to guide effective responses and to measure progress towards these targets. The estimates that we do have show progress when it comes to hepatitis B vaccination and blood safety, but major challenges in terms of prevention, testing, and treatment. ECDC has launched its first ever monitoring system for hepatitis B in 2019, and we're just about to launch the next one, 2021, where we're trying to support countries develop estimates across all these targets and goals. When it comes to HIV, I think it's fair to say that we have solid epidemiological and modeling estimates to guide and effective responses and to measure progress towards key targets. Overall, our region is not on track to meet the target of a 75% reduction in new infections by 2020. And when it comes to the treatment target in the western parts of the region, we're doing relatively okay with these targets. But when it comes to the central and eastern parts of the region, we're lagging far behind. And in terms of priorities for the full region, we need to scale up testing. We need to link people to treatment once they have been diagnosed. And we have gaps still when it comes to opioid substitution therapy and needle exchange programs, especially in the eastern parts of the region. And PrEP for the full region is still a gap area. So I would like to thank colleagues at ECDC, WHO, UNAIDS, and our consultant team who have helped with this analysis. Thank you very much.